Denosumab is a fully monoclonal antibody that binds and inhibits a specific substance called receptor activator of nuclear factor kappa beta ligand, also known as RANKL. Inhibition of RANKL provides anti-resorptive effect through inhibition of osteoclast differentiation, activity, and survival. Clinically, such inhibition of osteoclast activity can significantly reduce the risk of vertebral fractures, non-vertebral fractures, and hip fractures in postmenopausal women. So let's explain the mechanism of denosumab effect. Here we have bone matrix. Bone matrix contains a significant amount of calcium molecules. In addition to this, we have some amount of calcium molecules that circulate in the blood. In normal condition, the concentration of calcium in the blood is between 8.5 to 10.2 milligrams per deciliter if you are in USA, and 2.12 to 2.55 millimoles per liter in a metric system. In bone tissue, we have two major subtypes of cells. First of all, it's preosteoclast. Preosteoclast on their surface have a specific RANK receptor. In this state, preosteoclasts remain passive and basically they just waiting for the activation. Activation of preosteoclast is provided by osteoblast. Osteoblast produce a specific substance called RANKL. RANKL molecules bind to preosteoclast and the site of their binding is RANK receptor. Binding of RANKL molecules to RANK receptor results in activation of osteoclast. With activation, they begin to produce proteolytic enzymes, which begin to destroy bone matrix. This process we call bone resorption. With bone resorption, calcium molecules which were contained inside the bone matrix begin to enter into the blood. In normal condition, this helps us to maintain the normal blood calcium level. Also, during osteogenesis, calcium from the blood can go back into the bone matrix, so this process works both ways. But in some circumstances, bone resorption can become overactive. So let's suppose that in postmenopausal female, osteoblasts begin to overproduce RANKL. With increase in RANKL production, more RANKL molecules will bind to RANK receptor on osteoclast. This causes overstimulation of osteoclast, and in response to this, osteoclast begin to produce more proteolytic enzymes that begin to destroy bone tissue matrix. The more severe is the bone matrix destruction, the higher amount of calcium molecules will exit from the bone matrix into the blood. And with increasing income of calcium into the blood, the concentration of calcium in the blood increase, which results in hypercalcemia. So how we can decrease bone tissue resorption? We can prescribe denosumab. Denosumab binds to RANKL molecule with formation of a stable complex. The point is that only free RANKL molecules can bind to RANK receptor. So once denosumab binds to RANKL, RANKL molecules becomes useless, and with decrease in free RANKL molecules, the stimulation of osteoclast decrease, which results in significant decrease in bone tissue resorption. With decrease in bone tissue resorption, the exit of calcium from the bone tissue into the blood decrease, so the concentration of calcium molecules in the blood will decrease, which help us to correct hypercalcemia. Denosumab in treatment of postmenopausal women we use under very specific circumstances. The reason is that, as we know, the first-line drugs in treatment of postmenopausal osteoporosis are bisphosphonates, and only if person is unable to comply with instructions for administering of bisphosphonates or have some contraindications for prescription of bisphosphonates, we can consider denosumab. Also, for prescription of denosumab, person should have a combination of DISCO, age, and number of clinical factors for fractures. They all grouped in a table which you can see on the right. And the major contraindications for denosumab is hypersensitivity to this drug or hypocalcemia.